one thread that I want to pull on, primarily because we actually on a previous guest talked about this idea of a diagnostic odyssey. And she was Catalina in our last podcast. She has cancer, but that's a slightly different. That's different. And she said that her diagnosis made her understand just a little bit more about the diagnostic odyssey that rare disease patients go through. So, actually, do you mind educating, at least giving the audience a almost a glimpse into what that diagnostic odyssey looked like for your daughter?
Yeah, and I can. And actually, she was quite lucky. Like she was diagnosed with a rare disease at the age of 24. But it's incredible, really, when we look at where we are in relation to so many other patients, not only just in our community, but in the rare disease community, about where we live, about how quickly she was diagnosed. I mean, we live in just outside of Toronto, so we have access to the best hospitals in Canada. She was diagnosed really quickly. There are medicines to treat the disease. It doesn't cure it, like I said before, but it does slow the progression, which gives us time to actually hope for new medications that will reverse the disease. But I'll give you I'll explain how she was diagnosed. She literally she was walking down the street on the day I think it was the Vancouver the gold medal game of the men's hockey uh, day, February. I can't even remember the date, but it was February 2014. She literally stopped breathing. She couldn't. It was cold. It was really cold outside, and cold obviously restricts your breathing anyway. She literally. I mean, we always say, "Oh, I can't breathe," and she couldn't breathe. And so she does work at a hospital in Brampton, and she just figured she would go into the hospital and she would ask. She figured they would say if she had asthma and she'd get an inhaler. And when she went into the hospital, and she went into emergency, and they literally admitted her for 10 days onto the
Wow.
cardiac floor. So her diagnosis, but that's what I mean. We had seen stuff before. We just assumed it was because she wasn't as active and her cardiovascular system wasn't as good as it was when she was skating. And so she just needed to get back to the gym. We make excuses for a lot of things. So she was admitted to the cardiology floor for 10 days at Brampton Civic. That was the first time. It wasn't the first time I'd heard the words pulmonary arterial hypertension, because I had heard about the disease before, but it was the first. But what I remembered when I heard it that week was that it wasn't good. I knew it wasn't good. And we were basically told that at the time that her only hope was a double lung transplant at the time. And then it again, we were really lucky. I think maybe it was because she was so severe that it really only took 2 months to get an appointment with the PH clinic in the Toronto General Hospital. So she was really, really lucky. But we have patients that can wait like 6 years, 7 years. Asthma is a really big one. Women, PAH, the rare form of PH, affects women of childbearing age. That's the biggest cohort for this particular part of segment of the disease, the rare form of the disease. And it's really unfortunate because when women go to see their family doctor because they're feeling a shortness of breath, or they're having trouble, they're really tired, what they get usually is, "Oh, you're a new mom, so don't worry about it. It happens to everybody. It'll pass." And when it doesn't pass after a year or so, then they think they start looking at things like asthma and those kinds of things. So sometimes it takes a really long time to get diagnosed, and you can go from doctor to doctor too. Again, we were really lucky, and I'm just so appreciative of the fact that we were.